Xavier Centre, Rotary leader, and we are witnessing here the handover of Maternal Child Health project to Hoima District, which is going to support 7 health centers, and it's an assortment of equipment. As you know, we lose so many mothers, so many children during their first, during childbirth for mothers, and the first few hours when the child is born. But indeed, there are also many children who are born preterm, before their time of being born. And if you have a health center which does not have the right equipment, you are going to find that we are going to lose such children. So what the Rotarians have done, Rotarians from Nansana, from Hoima, from Bweyogerere-Namboole, from Kasubi, from Wakiso, have combined together with Rotarians from around the world to provide support and indeed train health caregivers to those different health centers. My appeal to Hoima District Administration, but most importantly to the in charge of the different health centers, to see to it that this equipment that we are handing over are made good use of, because when they are made good use of, we are dealing with saving of lives of the mothers, of the children, but also that means that we are building our country. And as you all know, this year we've been running on the theme of Rotary Eyamba. And so as Rotarians, as Rotary leaders, every time there's an event like this, we are seeing the actual action of Rotary. What we are witnessing here are lives saved. What we are witnessing here is indeed lives and dignity to the mothers. So we want to thank the many partners that have worked with us, but most importantly to thank the health caregiver, the health providers, the in charge of the health centers, because it's through their hands that these equipments can be cared for, well utilized, and they can be able to save the many lives we hope that will be saved.
Over $50,000, and that is in Ugandan shillings, about 190 million. This is a project that is going to touch a number of lives, especially in the area of maternal and child health.
All of us have been through birth. And if you visit different facilities, and for us women who have been into the labor suits, we really deserve different awards, because it takes your life to either get out or remain in a labor suit. So MCH, as one of our focus areas, we are really, really humbled to have this equipment come here. Some of the facilities where we went to, really you would see if a woman comes, she just has to give birth wherever she has arrived from. So I want to thank all our partners who have made this come through. In a special way, I want to thank our club members, especially the PE, Dr. Mark, kindly. In Runyoro we have a saying which says about Azaro Wawakoraki. Azara. Some of these things we wouldn't understand, like Dr. Baluku has been saying. He says screens for you, you're thinking maybe they are TVs, and then they bring those clothes. He says a shocker, you're thinking it's something doing with electricity. Then they tell you it is something that works with blood. So, because we have these people who are in that classification, it made this work easier. I have invited these doctors several times, Dr. Baluku and Dr. Lawrence, to join Rotary. I do not know what kind of interpreter they will need to join us, because the more the hands, the lighter the work.
So this gesture by Rotary Club directly benefits the people within our area, our catchment population. We serve about over 35,000 people, and majority of these people are from within Hoima. Others come from Hoima City, but we also have those from other districts like Lisa, Masindi, and including Democratic Republic of Congo. You know, we are surrounded by Lake Albert, sorry. So majority of the people cross over to Kigorobya Health Centre IV to seek for health services. We pledge to ensure that these equipments we have received are properly utilized, they are routinely maintained, and we shall ensure accountability for donated items. No issues that will misplace one. And they have been distributed to 7 health facilities in Kigorobya Health Centre IV inclusive. We have Chibiro, Baranga, Sikiseke, Kasumoro, Chibaire, Mbarara. And with me, I have the in-charges from those lower facilities. Pulse oximeter is very important. It detects the levels of oxygen. Once they are low, it will alert you and you'll be able to administer oxygen. So it moves hand in hand with the oxygen concentrator, because you can't put someone on oxygen until you know the oxygen levels of that patient.
So on behalf of the Health Department of Hoima District, we are very, very much happy for this generous donation and contribution from the Rotary clubs mentioned before. So you have really lived to your motto, service above self. And this, what you've given us here, they are not just equipments. This is beyond the equipment that you see here. This is a hope for the mothers in Kigorobya, for the mothers in Hoima District. This is hope for the preterm babies born at the facility at 2 a.m. It gives them a fighting opportunity, it's a fighting chance for them to survive. So it is so much beyond the equipment that we are seeing here. These are lives that are being saved. So we are very, very grateful and we continue to appreciate these efforts.
I would like to congratulate the Health Department of Hoima District Local Government, headed by the DHO, Dr. Baluku, and the team behind there, for having received the equipment which are going to smoothen your work the more. Lobbying for funds which will help us to improve on the structures we have in the district. Most especially here at Kigorobya Health Centre IV, since it is the biggest health facility we have. We are going to continue like that. But I am assuring you that by the time you come back, you will find a different picture here.